In this video, we will discuss the most important 10 topics. So the first one, it is HIV entry inhibitor. So first of all, what happens? Glycoprotein 120, it binds to CD4 receptors on the CD4 cell. The drug inhibiting glycoprotein 120 is fostemsavir. So in Kolkatan language or because in Bengali language, it's a fostem. Fostem, so look like first step. So first step is inhibited by fostemsavir, that is attachment, that is binding to 120. After it bind to CD4, now the drug inhibiting CD4 receptor is ibalizumab. Ibalizumab. So it is saying I bind after IBA. Ibalizumab says I bind after attachment. So second step is inhibited by ibalizumab. Then third thing is we can inhibit the co-receptor which is CCR5, that is inhibited by maraviroc. Maraviroc inhibits the co-receptor. And lastly, we can inhibit the fusion when the drug bind to glycoprotein 41. The name is N-fuvirtide. The name says bind to envelope and fusion of virus with the T cell is inhibited. The name says completely. Okay. So this is the first topic. The second one is mechanism of anti-epileptic through GABA. Remember, GABA is stored, then it is released. After that, it is either metabolized by GABA transaminase. So if we inhibit that, GABA level will increase, and the drug inhibiting this is Vigabatrin. So again, the name says it is saying GABA transaminase inhibitor, and it causes visual field contraction as a side effect. Second drug, GABA will be reuptaken. If we inhibit the reuptake by inhibiting the transporter GAT1, GABA will not go back. It will stay there, produce more action. And the drug inhibiting GAT1 is Tiagabine. Again, the name says transport inhibitor of GABA. By inhibiting GAT1, that means GABA transporter 1. Okay. Then third thing, the GABA which is produced, it may act on the chloride channels. So the drugs modulating the chloride channels are barbiturates and benzodiazepines. Okay. So you should be thorough about these. The next topic is cystic fibrosis. So we have cystic fibrosis protein. There is defect in the proteins, the chloride channels. So there are two type of drugs. One are called correctors. Second are called potentiators. Correctors will correct the misfolded protein, whereas potentiators will open the channel. So which are the potentiators? Remember, name of all of them will end with captor. So captor says cystic fibrosis transmembrane protein. Okay, so captor is the common thing. Now potentiator, they will open the channel. So they say it's my duty to open the channel. So it's I means it's my duty. Duty means duty. So Eva captor and Dute Eva captor. Dute captor is a new drug. So Dute Eva captor, and remember deuterium is attached to Dute Eva captor, so it is long acting. It's a longer half life than Eva captor. Both are potentiator. Then correctors. So correctors say that let the engine vibrate. So let the engine vibrate means L means lumacaptor, T means tizacaptor, engine E means elexacaptor, and vibrate V means benzacaptor. So this is again a new drug. So these are correctors and potentiators. Okay. The next, there are some scales which can be asked in the INICET exam. Rumac-Matthew scale, that is for paracetamol overdose. So when to use N-acetylcysteine, this scale is used, Rumac-Matthew nomogram. Hartford nomogram is for aminoglycosides. Naranjo scale is for adverse drug reactions, and Matske scale is for vancomycin. So remember these scales. The next one you all must be knowing about Lineweaver Burk plot. How to know which type of enzyme inhibition it is. It's a plot between 1 by S and 1 by substrate and 1 by reaction velocity. So in competitive inhibition, you can remember the lines will cross at y-axis. If the lines cross, C means competition, C means cross. If the lines cross at y-axis, it is competitive. On the other hand, if the lines start from x-axis and they go away, just like your x, they go away, but mere yaar dada koi competition nahi, so x da koi competition nahi, so there is non-competitive inhibition. Now, if the lines are parallel, it is uncompetitive inhibition. You can see the U, if we draw parallel lines and then meet them, it becomes U. So U means uncompetitive, they are parallel lines. And if the lines are crossing but not on y-axis, anywhere else, the lines are crossing somewhere else, then it is mixed inhibition. Okay, so remember these type of inhibitions. Next is different type of effect on blood pressure. Drugs producing different effects on blood pressure. So biphasic response, BP increase also, decrease also, produced by adrenal. Then only increase with the bradycardia, it is produced by noradrenal. only decrease with increase in heart rate is produced by isoprenaline. Then if we give alpha blocker first and then give adrenaline, then BP only falls. BP do not increase. So normal effect is reversed. So this is known as vasomotor reversal. Now, if the graph keep on decreasing with same dose we are giving, graph keep on decreasing, it is a tachyphylaxis. Tachyphylaxis shown by ephedrine tyramine-like drugs. And lastly, after giving atropine, normally acetylcholine produce bradycardia, decrease in heart rate. But after giving atropine, high dose of acetylcholine is increasing the BP and heart rate. This is called the nicotinic effect of acetylcholine. Okay? So these graphs are also important. The most important anti-diabetic drugs are gliflozins. Gliflozins are SGLT2 inhibitors. So what is important to remember about them? Their name ends with gliflozin, canagliflozin, dapagliflozin, empagliflozin, plenty of drugs are there. So what is important that they are used in type 2 diabetes mellitus, and they have two special advantages. They are very, very good for heart. They have protective effect on heart. In fact, they are approved in congestive heart failure. They can decrease mortality. Second, they are very good for kidney also. They prevent the progression of kidney disease in diabetes. So these are the two special points. Major side effect you need to remember. One obviously is UTI because glucose goes in urine. But second, very important, if we use them in type 1 diabetes and stop giving insulin, they can lead to euglycemic ketoacidosis. Euglycemic ketoacidosis. Okay. Then adverse effect of anti-HIV drugs are important. Zidovudin, if you are very जिद्दी तो आपकी हड्डी तोड़ देंगे, मैरो सप्रेशन हो जाएगी, बोन मैरो सप्रेशन. अबाकाविर कॉज एमआई, आपके अब्बा को पता लग गया कि क्या हरकतें करते तो उनको हार्ट अटैक हो जाएगा. जेलसिटाबिन खाने से मुंह जल जाता है, एप्थस अल्सर्स. एमट्रीसिटाबिन कॉज ट्री लाइक पिगमेंटेशन ऑन palm and soles. Didanosine, दीदी को पेनक्रियाटाइटिस हो गया. Stavudin cause peripheral neuropathy. So PNS, peripheral neuropathy caused by stavudin. Efavirenz खाने से weird behave करेगा, weird. It will cause altered mental status. Nevirapine पीने से liver खराब हो जाएगा, hepatotoxicity. And Navirs cause lipodystrophy syndrome. That means metabolic side effects. Then lastly, we need to know about antidotes. I hope you all know by now. Beta blockers, glucagon. Organophosphate poisoning is atropine. Benzodiazepine is flumazanil, same is zolpidem also flumazanil. Cyanide poisoning, hydroxycobalamin. Methanol poisoning, it is fomepizole, and if that is not given, ethanol. Same is for ethylene glycol, fomepizole first, second choice is ethanol. Iron poisoning, acute iron poisoning, desferrioxamine, and chronic iron poisoning, deferripiron. Acetaminophen or paracetamol, everyone knows, N-acetylcysteine. Valproate is L-carnitine. Atropine is physostigmine. Heparin, protamine sulfate, and warfarin, vitamin K. So these antidotes are very important. So lastly, new drugs. New drugs, we already discussed duty captor. Duty, we already discussed potentiator. My duty to open the channel. And TISA and Vancomycin are correctors for cystic fibrosis. Then sulopenem is a new carbapenem. Just like meropenem, it is indicated in UTI. Olezasiran, arsen is antisense oligonucleotide, and the name says oil ESA. So it will make oil easy. Oil means chylomicron. So it is used for chylomicronemia. Carbidopa, phoscarbidopa, phoslevodopa. These are the products of carbi and levodopa. They are used for on-off phenomenon in Parkinsonism, late Parkinsonism. Atrasentan, sentan means endothelin antagonist, ANT-N. The name ends with ANT-N. Endothelin antagonist. They are for primary IgA nephropathy. Fitusiran is a small inhibitory RNA. Siran is small inhibitory RNA. Fitu says it fixes insufficient thrombin. When thrombin is less, more bleeding. Where bleeding? In case of hemophilia. So used in hemophilia A or B. Then Geptosidan is a new drug. It's a topoisomerase inhibitor. It is indicated again in UTI. Topoisomerase inhibitor of bacteria used in UTI. Sujitrigine is like lamotrigine, sujitrigine. It is blocking the sodium channels. So it is used for pain. Landiolol is a new ultra short acting, in fact, the shortest acting overall beta blocker. It is a cardioselective beta blocker. It is indicated in supraventricular tachycardia, including atrial fibrillation and flutter. Then xanomeline and trospium is a combination of a cholinergic with anticholinergic drug. The anticholinergic drug do not cross the blood-brain barrier, so cholinergic action will be seen only in brain. So it is used for schizophrenia. Resmetirom, it is a metabolic modulator. It is basically acting on the thyroid hormone receptor beta. Thyroid hormone receptor alpha is present in heart and other places, but beta only in the liver. So it will affect the metabolism in the liver, and it is used for NASH, non-alcoholic steatohepatitis. Clear? So these are the important topics. Very quickly, I have told you. So all the very best for the exam.